everyone, my name is Linda Abel of Well Taken Care Of. I am a functional and metabolic health practitioner, and this is my orientation video so that you can learn a little bit more about me, my services, and why I do what I do. So the number one reason I do what I do is I want to help people be proactive when it comes to their health so that they don't slowly walk their health into decline. So all we can do is focus on what we can control, and what we can control is our strength, what we eat, how we behave, and get information, lab insights as to our current state and try to address it so that we can optimize our body and optimize our health. And I'm here to help you do that. So a lot of people think symptoms are just random or health conditions are random, but it's actually connected. So like blood sugar instability, insulin resistance, nervous system dysregulation, and inflammation shows up as fatigue, weight gain, cravings, poor focus, and hormonal issues. And what makes me different? So there are a lot of personal trainers, there are a lot of nutritionists, there are a lot of health coaches, and there are also a lot of functional health practitioners. However, there aren't a lot of people that are integrating all of that to help people get results. And that's what I do, and that's what makes me different. I use my pattern recognition to connect dots. I love finding the through line and getting to the root cause of health complaints and helping people thrive. So the number one thing you can do is my metabolic strength program. And strength is our metabolism. So of course, it's something that I had to offer. And I offer small group classes in Needham, Massachusetts in person. And for those of you outside of Needham or outside of Massachusetts, there are virtual small group offers as well. So I can certainly help you with that. And the primary goal beyond just, getting stronger and getting leaner is to preserve our body. As we age, I focus a lot on people midlife. I work with everyone, but midlife in particular, our hormones are fluctuating and our ability to synthesize muscle diminishes. So our muscle is our shock absorber. So it's gonna influence the quality of our life. And so I do it. And plus what I find too is when I'm training people, I gain some insights as to the relationship people have with themselves, with their bodies. Are they being collaborative? Are they making demands? And one thing I've also seen is that in order to get the changes that we want from our bodies, we must be compassionate with our bodies. We must listen to our needs, and our body tells us. And when we do that, then it delivers for us more greatly. So it's a collaborative relationship that we want with our body. And I gain a lot of insights with metabolic strength, and especially people on the GLP-1s. So we know it's important. I'm not judging anybody. I only want people to have the best outcomes on GLP-1. So I do help a lot of people do that with strength, and then also with nutrition, so that you can optimize your diet, because optimal weight loss is a third muscle mass and 2/3 fat loss. However, if you're not doing it optimally, you'll lose 2/3 muscle mass and 1/3 fat loss. And then if that's the case, then that's why it's difficult to maintain if you happen to get off the medicines, because then the lack of muscle mass reduces your metabolism. So we just want you to get the best outcomes. And whether or not you're thinking about GLP-1s or you're on them or you want to get off them, I I have a group. It's the Metabolic Collective. So the purpose is for people to really learn how to eat, learn how GLP work and what you can do in your own life to mimic those same types of results, because it's really about optimizing your blood sugar. And I've been doing sugar detoxes for over 15 years, having so much success in as little as 7 days. And that is one of the things that the drug does is improve insulin sensitivity. And then also you can mimic the gastric slowing, the gastric emptying effects. There's supplements that you can take, and you can optimize your macronutrients to do that as well. So I want people to have options, and when people make choices, I want them to have the best outcome. So that's the purpose of my group, the Metabolic Collective, is so that we have this community where we can support one another. You know, I was a former center manager at LA Weight Loss, for those of you who may remember, it was in Government Center. And what I really loved about it, not necessarily the products that they were promoting, but I loved the sense of community and just the accountability piece, because a lot of times people know what to do, but it's just having a structure, having a framework, having a support, and having someone guide them through the process. And I do that well. Have immersed myself in DBT, dialectic behavioral techniques, so I can help people process, you know, behaviors that and emotions that come up that influence behavior. And then I'm certified with American College of Lifestyle Medicine and Well Coaches, so I was finally able to put language to in a framework to moving people from where they want to be to their destiny, and that's with the collective. So that takes place about 4 times a year, and it's a cohort, and the next one is going to be starting in June. And then finally, my method program, that's my one-to-one program it includes lab testing so we can get to the root cause. So I've helped a lot of people. I've helped people with migraines, with a whole host of autoimmune conditions, with different blood sugar dysregulation, PCOS, Hashimoto's, weight loss, inflammation, pain. And that is my method program. It's comprehensive. And then I also, within the method program, I have 3 tiers. So there's tier 1, tier 2, and tier 3. And what makes the tiers different are just the levels of lab testing, and then the level of support, and then also the condition that the person presents with. And once we discuss that via our strategy session, then I'll make a determination as to which tier I think would get you to where you'd like to be. So tier 1 is for more of the self-starters, maybe people who are knowledgeable and just kind of need a framework and need guidance. And then tier 2 are for people who've been told, you know, test results are fine, but they feel off. And then tier 3 is for people with lots of complex situations going on, and they're trying to get answers, and I can step in and help with that. So that is my program.